This fourth and final 30-minute segment compares a personal preference for a lifestyle based on an attitude of organized left brain judging, as opposed to a personal preference for a lifestyle based on an attitude of flexible right brain perception. Alex and Frank now focus on order and flexibility, brain damage, and categorical or contextual framework. We begin with order and flexibility.
Which brings us to our last subject area, lifestyles. Now, the lifestyles in Jungian personality context is the reason I'm having some difficulty formulating this right at the moment is I do have my own disabilities in terms of right hemisphere function, but I'm trying to find a way to say, and I want to share this on the camera so people listening can understand this. Carl Jung did not talk about judging and perception. Isabel Myers and Catherine Graves, admirers of Jung, who developed the Myers-Briggs type indicator in 1943 as a way to help the war effort. Most of the people, the men were overseas, women were filling factories, and Isabel and her mother Catherine felt that if we had an instrument for helping people understand their brain hemisphere functions, that they could be put in jobs, they would be more effective, they would be happier, and they would be more productive. So it came out of a very difficult period of time. I also was born in 1943, and my great interest in this particular work, I always thought there was some synchronicity to that. But they introduced the judging and perception dimensions, which fit Jill, what Jill says, with the judging area being the organized area, which is characteristic of the left hemisphere, the perception preference being flexible, which is characteristic of the right cosmic hemisphere. Now, Jung, when he did therapy, tried to decide what the person's preference was in order to be a more effective therapist.
Correct.
But he did that to a large extent intuitively. But Isabel and Catherine, trying to develop this instrument, paper and pencil, that people would take, had to find a way to make that choice. The people would make that choice for themselves as they answered the question. And so they created the judging and perception area. And so now there are two ways to judge, thinking or feeling. That's a process of decision making. There's two ways to decide, sensing or intuition, but facts or imagination. Now, in the context of lifestyle, a judging person would appear neat and dressed, hair combed well. Their car would be driven in the fashion where it was clean and so forth. Their living space would be organized. The perceptive person would be more flexible. They might have wrinkles in their shirt, so their hair might be messy, but it wouldn't concern them. I'm a perceptive type, and I had clients, judging type clients, who would come in and sit on the other side of my desk and begin to organize the paperwork on the desk. And I'd look at them doing it. I didn't become upset because I understood that they cannot, a difficulty with disorder. So their process to go through life, putting things in order, where I'm less concerned about that. I know where everything is. If somebody messes with it, it upsets me because I knew where I put it, under whatever I put it under, but now it's out of space. So if we talk about this in terms of, Jill talks about innate or inherited patterns of response that are orderly and seek closure on things, want things decided. And spontaneous responses in the right hemisphere that are adaptable and seek flexibility. Now, the injury to that part of the left part of the brain that seeks pattern of responses and so forth. The American Brain Injury Association speaks of in terms of catastrophic reactions, depression and anxiety. How do you see that?
Well, first of all, I'd like to establish something that I think in Myers-Briggs, as well as Jill stated, that there is nothing that is inflexible. And Myers-Briggs says that you can learn both styles of internal, external, thinking, feeling, judging, perceptions, and that becomes a matter of choice.
Right.
Jill presents it, which is something that is new within the neuroscience of definitely within the last 20 years, that the brain is not static, it's not
Right.
necessarily fixed, that there is what is called plasticity.
Right.
And she demonstrated it very well. She was able to regain left hemisphere functionings. But again, the personality preference, as well as preferences in terms of hemisphere dominance, we choose that. And that's what Myers-Briggs were pointing out. And that somebody who is very organized, usually that would be dominant, but they could also be flexible.
Right.
And sort of like, I have troubles, and I really correct people when they say I'm a perfectionist.
Right.
Yet they're perfectionists in what they choose.
Right.
My mentor in graduate school, he was a phenomenal, nice guy. And we were a research group. And he could go through statistical procedures and research design and correct imperfections in design. And he was definitely organized.
Right.
When it came to that, and he held us to high standards of perfection.
Right.
But you go into his office, and you would want to organize his desk, even though that didn't bother you. He was totally flexible,
Right.
to the point. But there's a certain organization. One time we turned in proposals, and he said, well, yes, I remember receiving them. He said, when was it that you gave it to us? We said, well, it's about 4 or 5 weeks ago. He said, oh, it would be right about here.
Right. Right.
So he had that organized disorganization. So there's that both ways. But yet there is that left-right hemisphere dominance. And so that I've fortunately never observed him in a catastrophe. I don't know what would have happened, but I think if his left hemisphere had been damaged, he would have probably gone back to his right first love, and he would have been a musician again. He was a great professor, but he loved music too.
Well, if a person lost their catastrophic response, it certainly would be, or no, their pattern response rather, it certainly would be wonderful if they could move on to something else. But what if a person was hurt by the loss of a profession, let's say, like I was disabled from my profession. This is catastrophic, and I went into depression, and I still suffer from anxiety as a result of not being able to trust my judgments.
Well, I think we have to look at catastrophic reactions if on either side of the hemisphere, because if the person who was just totally flexible, free-spirited, if that was no longer available to them, and they had to become orderly and logical, that would be something new to them, and depression would set in, and anxiety.
It almost sounds hellish.
Definitely is, and that's what brain injury does. And brain injury requires a lot of adjustment. That's why we're perfecting more information in terms of imagery, that the MRI was wonderful, but now that we have PET scans and functional MRIs, we can see the brain functioning and create situations to improve that.
Right.
I like the word improving as compared to rehabbing.
Okay.
Brain damage to the judging-oriented left brain, seeking closure through a process favoring orderly patterned responses, may produce anxiety, depression, and catastrophic reactions. Brain damage to the perception-oriented right brain may lead to dysfunctions relating to loss of the big picture.
Okay. But so we improve.
But you don't like the word change either.
No, absolutely not, because leaves change. I don't. I just get better. It's sort of, I jokingly tell people my first name's Alexander.
Right.
My initials are ATG. I'm Alexander the Great, but every day I'm getting better.
Okay.
So we improve. And that was a nice thing that Jill's book pointed out so fantastically is that but I'm sure she went through her states of depression and anxiety, which she states she did, because there was that adjustment. But she had a support system, her mom, that just was encouraging. And it wasn't like she kicked her in the butt every day, but she encouraged her in ways of, well, what would you like to do next? And so it takes away some of that depression and anxiety, but it is something that is definitely quickly achieved
Right.
with a catastrophic incident to either hemisphere. But it affects the left hemisphere person so much more because they're not used to this free spirit, and it becomes more greatly foreign to that person because they lose their organization. They've lost their boundaries, their box.
Might such a person then go to self-medication?
That is a definite fear, absolutely, that they utilize that. And even in personality disorders, someone who is organized or left hemispheric, that when they lose some of their organizational skills, or they find that the world around them doesn't function like them, you can fall into addictions, be it prescribed medications or street drugs. That's something to be careful about.
And the second DVD in this series will be discussing personality disorders.
Exactly, and what the therapists as well as other professionals have to deal with. The primary care physician has to look at these personality disorders also, which is where it's wonderful to have a blending of psychology and primary care physicians.
So it's not enough simply to give antidepressant to a depressed person or an anti-anxiety medication to an anxious person.
True, there's some of the personality attributes that need to be considered, and even the medical field, even though they recognize that there's a injury, especially if it's a head injury, that be careful not just to jump in to solve it with medication, but to get some background information as to what the person was like historically,
Right.
and then different things like that.
So in other words, we're looking at, from what you're saying before about making clear that if a person's judging type, it doesn't mean they can't learn to be flexible. But there's flexibility, that doesn't mean they can't learn to be more orderly. And that this is important. The treatment of personality disorders in which a person might lose that flexibility or that balance, we know that medication will calm that person down so that they can learn or do therapy. But what would therapy be? Would it be the Freudian kind of therapy, looking at childhood trauma and how that's affecting a person who's had a traumatic experience in the present? Or would it be in terms of education, in terms of cognitive behavior adjustments.
Well, this is one of the reasons we're doing this work, is to present to the professional world, because it even affects the attorneys, as you've experienced it, that if you're dealing with someone who was in a motor vehicle accident and they suffered head injuries, you need to deal with them so that they can, in the legal form, they have to think logically. If the damage was to the left hemisphere, how do you use the right hemisphere to bring them to the appropriate conclusions, as well as if the right hemisphere is damaged and they're totally logical, how do you work with them when the legal system, the court system, is not logical in terms of timing?
Right.
It's when the judge is available and two attorneys are available and the petitioner or the injured person is available. A logical person looks at it and says, well, I'm here, why aren't they?
Right.
Whereas the person who's right hemisphere says, okay, that's the system and I can work within it.
So would it be safe to conclude from that, just as a general picture, that a person can be oriented toward the left hemisphere in their behavior, oriented toward the right hemisphere in their behavior, or be relatively balanced between the two hemispheres?
Well, the purpose of education and personal improvement and learning is to develop that balance. But so many times as professionals we're dealing with an imbalance, and if then there's a head injury, the imbalance is even greater. It's important to recognize it. Now, Freud gave a lot of new insight to the medical world as well as the counseling world as to childhood experiences.
Right.
But is that important? Does the past predict the future? There's no doubt about it that we are part of our past, but as adults, we also learn new facts, and we can learn to adapt or adjust. If there was difficulties in the adjustment or the adaptation, it's the professional's responsibility to assist with that. But
So you don't believe in the bad Steve concept, that a person is born with certain genetic dispositions?
I don't rule it out,
Right.
because there's a lot of things that happen, because even during gestation you have gene mutations,
Right.
that we have different types of individuals that are born handicapped. We also have the factors of the environment of mom during the 9 months can affect the genes, all this apart from the gene pool.
Right.
So yes, there are biological factors, and that's important to recognize it.
Right.
And but then there's the environmental factors that affect those genes.
Right.
That someone who grows up in an abusive situation, it doesn't necessarily mean that that's the way that they're going to be, because they still have the choices as adults.
There's nature and nurture.
Exactly. And there's the two working together. But the therapist needs to understand also, if there is something in the present, it can be influenced by the past.
Right.
And it's interesting because I'm working with a family that the child is having difficulties in school, especially behavioral. And then reflecting back to, oh yes, there was a head injury. And it happened then. And then a lot of the neuropsychological testing shows it.
Right.
That a 16-year-old was able to function well, but there still was
Categorical framework of left brain judging orients toward linear time in terms of past, present, future. Contextual framework of right brain perception orients toward concepts such as timeless, cosmic consciousness.
Some abnormality that exists. I'm probably more of a genetic pool disability, whereas yours was head injury.
Right.
I cannot do phonics. I am not a phonetic reader.
Right.
My brain doesn't function that way. I first learned that when I failed rhythm band in first grade and repeated failure to second grade and third grade.
Right.
I can't clap my hands to music.
Okay. Could it be that rather than nature and nurture, it could be nature plus nurture?
It was nature from an auditory point of view,
Right.
my hearing.
Right.
I compensated visually.
Okay.
So I learned to do something differently. I learned to read through sight word methods. I learned to clap my hands to music by watching somebody who's doing it correctly.
Right, okay.
So I became visually strong. And so my dominant sense
Right.
for learning is visual
Right.
and kinesthetic.
But it sounds like an educational process. It sounds like you start with natural genetic existence, and through education, which takes effort, you add to that.
Right.
You adjust and mold. That nurture adjusts and molds nature, as opposed to the two of them constantly being in conflict.
Exactly. And the important thing is to recognize what is nature. And the important thing is that in nature, that parents don't push a child
Right.
to do something that's against his nature.
Right.
If there was only one way of learning to read, and that was phonics,
Right.
I would be illiterate.
Okay. Which is interesting, because Isabel Myers actually endorsed a phonetics program for teaching people to read.
Oh, it's a very effective way because it facilitates spelling and all types of things.
But not
But
for all people.
Exactly. And what has been found in research, that 85% of individuals, of a group, will learn effectively with that one procedure. But then what do you do with that 15%?
Right.
You find another way.
Right.
And but it also affects other things too. When it came to second language learning, it was very difficult for me because it's a listening skill, especially the way we teach it
Right.
in the United States. It's a listening skill, and so it was very difficult for me. Yet English is my second language.
Right. Do you want to say something in your first language?
Yet.
Good. Okay. The last item we have on the lifestyle chart, so we don't forget it, is the fact that in the left hemisphere, we tend to see things categorically, in categories. And there's a tendency to believe that the past predicts the future.
Mm.
So you have this organization of people who look to past experience as a guide to what they do next. In the right hemisphere, as opposed to categories, sorting things into categories, there's a contextual view of things as this cosmic consciousness, the big picture.
Mhm.
And where we don't look to the past for anything but indicators that we might use to inform ourselves, but we realize everything happens in a larger picture. And one of the, if there's right hemisphere damage, according to the American Brain Injury Association, there's a tendency for loss of the big picture
Mhm.
in the right hemisphere. Would you want to comment on that?
Well, the loss of the big picture is very difficult because for the left hemisphere not becoming dominant, because there is that organization that is important to be followed.
Right.
And if the right hemisphere is damaged, the left hemisphere has to work hard to regain a lot of the past, and then also to look towards the future. And
Because
it's easy to function in the past and present and not predict the future, whereas the right hemisphere person, with some of that creativity also that's in the right hemisphere, that globalization may be lost too in that person.
I'm getting the impression from what you're saying that the left hemisphere needs the right hemisphere to distinguish between past and present.
Absolutely. And both in balance is what Piaget said, that the only way we can learn is if there is imbalance.
Right.
Where most people explain it, if you don't learn from your mistakes, you're goofing off.
Right.
Piaget says we have to have the imbalance in order for learning to take place.
So we have to grow against something,
Right.
or pushing against something.
And take what is difficult and apply it to make it part of our lives. We have to adapt or accommodate and assimilate.
And the brain loves novelty.
We like challenges.
Right. So in order for, we understand that the brain continues to produce the materials with which to make neurons.
Mm-hmm.
But in order to make those neurons, the brain's got to be motivated.
True. But you can also see in our language, yours and mine, we showed left-right hemisphere functioning. You like novelty. I like challenges.
Right. So it's a choice of words.
But choice of words also reflect our thinking.
Right.
Because we can't say anything unless we have already thought it that way.
Right.
Now we're getting into Chomsky and Vygotsky as psycholinguists. Which they're pointing out that it's a thinking process,
Right.
and we think it, therefore we can speak and behave. And so that judging and perception is important to our thinking patterns or style.
So in other words, in order to be able to walk, we have to be able to think about ourselves walking.
Yes, we perceive it. Because we have encountered feral children, especially back in the 40s and 50s, and feral children being raised by animals.
Right.
And they were not upright walkers.
Right.
They were on all fours.
Mhm.
So it is a child seeing adults and then logically saying, I fit in. And Piaget would say that they get into those tertiary responses.
And that's why kids play with dolls or trucks or miniatures of the larger items that they deal with.
Sure. We miniaturize, we don't minimize our world, we just
Right.
miniaturize it.
Right. Like cell phones.
Well, I like the advertisement. Should we really call this a phone when it does everything and you can talk on it?
Right. I want my Star Trek phone where I just pin it on my shirt, tap it.
I'm with you.
Okay. Instead, I have to carry it in my pocket, and I have to remember to tune it down when we're doing this and when I'm in the movies.
Which also is a good example of, I'm a good logical thinker, but then I also have to incorporate within my left hemisphere associating time.
Right.
I did not grow up with computers.
Right.
I did not grow up with cell phones. And so I have to make a stronger effort to become a technocrat.
Right.
And I'm not being resistant, I'm just not taking the time to go into that future aspects of it.
And taking that as a segue, we will see you soon with the second DVD, where we put what we've learned on this one into the context of understanding and treating personality disorders. Thank you.
Good.